At the Quirino Memorial Medical Center Pharmacy, we strive to achieve the best outcome and best experience by providing safe, excellent, and cost-effective healthcare to all our patients. Have you ever wondered what goes behind the scenes when you handle your prescription? Join me as we take a tour of the pharmacy and find out together.
For the outpatient, the pharmacist will receive the prescription and make sure it is valid and fulfills all legal requirements. Using the Hospital Operations and Management Information System, or HOMIS, a sales order will be generated and the pharmacist will note the SO number at the face of the prescription. The patient or client will be instructed to pay at the cashier. After payment, the client will return to the pharmacy to hand the official receipt together with the prescription. The pharmacist will prepare the medicines based on the prescription with OR. The patient or client receives the medication and the pharmacist will counsel the patient on the direction for use and other special instructions. We also cater to the clients with Medical Assistance Fund as approved by the Medical Social Service. There are documents required before receipt of medicines by the client or patient, such as guarantee letter, clinical abstract, photocopy of government-issued ID, and the prescription. The employees of Quirino Memorial Medical Center also have a privilege to purchase medicines worth 5,000 pesos for free, and the promise that such employee have gone through the employee's health service. For the admitted patients and ER patients, we practice a modified unit dose drug distribution system. Unit dose drug distribution system is a pharmacy coordinated method of dispensing and controlling medications in organized healthcare settings. Medications are prepared in a single unit package for not more than 24-hour supply of doses delivered at the patient care area at any time. The detailed QMMC pharmacy processes are the following. Prescriptions for standing orders are forwarded to the pharmacy by the nurse or nursing attendant. After the clinical pharmacy validates and verifies the prescription, this will be forwarded to the encoder for charging. After encoding, prescriptions will be handed over to the pharmacist on duty and prepares the necessary medicines and medical supplies available in the pharmacy. The prepared medication and medical supplies of each patient will be labeled accordingly and will be counter-checked by another pharmacist on duty. After counter-checking, the medications and medical supplies will be picked up by the nursing attendant or the utility. For stat orders, nurses may use the pneumatic tube for faster and immediate delivery of service. However, dangerous drugs are not permitted to be placed in the canister for PDEA compliance and other medications that are motion sensitive, biologicals, and other medicines and supplies that do not fit the canister. The pharmacists are also responsible in refilling medications in the operating room. Our pharmacist refills the tackle boxes at least twice a day. Each patient is assigned with one tackle box which contains essential medications during a procedure. We see to it that there is enough supply of medications during the procedure. We also maintain stock level medications inside the OR CSR. By using the checklist, we make sure that the medicines are correctly dispensed and charged to the patient. In dispensing dangerous drugs at the OR, an RIS and controlled drugs administration sheets are required to be filled up by their nurses and doctors. In prescribing dangerous drugs, a special prescription or yellow RX is used by the physicians. Our pharmacy stocks have an extensive line of products listed in the Philippine National Formulary recommended and approved by the Pharmacy and Therapeutics Committee. We have stock rooms located beside the pharmacy and at the basement. Each medicine has its own stock card by which a pharmacist logs in when a medication is being delivered and stored inside the stock room, and logs it out when it's being pulled out and dispensed. We follow the standards on labeling, which is Stallman lettering, to emphasize the first three letters in capital to avoid error in dispensing. We also conduct semi-annual inventory. This activity will let us know the status of the pharmacy stocks, including its expiration. In case when medication is not available in the pharmacy, we outsource to different hospitals via emergency purchase through ambulatory conduction, provided it is on the Philippine National Formulary and in the hospital's Project Procurement Management Plan and Annual Procurement Plan. In compliance to the Commission of Audit, the following are the requirements for an emergency purchase: a valid prescription, request inquisition of supply, or RIS, petty cash voucher. These are the documents needed in order for us to replenish the petty cash. In the year 2015, clinical pharmacy service was introduced in our institution. It is a patient-centered pharmacy practice wherein the pharmacist works directly and collaboratively with the healthcare team. The goal of the service is to promote appropriate use of drugs and medicines to ensure maximum clinical safety and efficacy of medicines with minimum medication error. Clinical pharmacists are decked in different wards from 8 a.m. to 5 p.m., Monday to Sunday. It is considered as a milestone of the QMMC pharmacy section, as we are one of the pioneers of such service in the Department of Health. In 2017, we also introduced the Antimicrobial Stewardship Program. Antimicrobial restriction and pre-authorization requires the clinician to obtain the use of selected antimicrobials such as antifungals, carbapenems, fourth-generation cephalosporins, colistin, linezolid, and vancomycins. Attending physicians are required to seek approval from the designated AMS officer in the hospital or ID specialist through the restricted antimicrobial form. Clinical pharmacists evaluate and monitor the use of restricted antimicrobials in the wards. By year 2019, we were able to serve 4 intensive care units, 4 clinical wards, and pay wards. Every month, the section submits a monthly report in clinical pharmacy and antimicrobial stewardship program to the chief medical professional staff and to the medical center chief. The section is also invited to report the status of the service at the bi-monthly meeting of Professional Education and Training Office. When the COVID-19 pandemic happened, clinical pharmacy service was temporarily suspended in the wards to observe the strict compliance to social distancing. The service was ceased for more than a month, but the AMS program is still in effect, which was made to ensure the continuity of the clinical pharmacy in the hospital. As of today, clinical pharmacies are now available round the clock, but they are assigned in the pharmacy instead of their previous post. Their service can be reached through phone calls. Medication assessment was introduced wherein the clinical pharmacist assess all medications taken by the inpatients. The process starts after the dispensing pharmacist has checked the prescriptions for the availability. The clinical pharmacist assesses the medications of each patient based on the prescription received. Possible medication error, therapeutic duplications, and drug interactions are minimized through this process. Any drug interactions, special instructions, and precaution should be communicated immediately to the healthcare team via phone call. A database of the patient's medication assessment is maintained for reporting and future reference. This setup may not be ideal, but during these trying times of the pandemic, this still provides a support to the medical doctors and nurses, and most especially to our patients. In the Philippines, clinical pharmacy is still a new concept. We are a little bit late as compared to other countries, but the good thing is, we have already started. We are able to introduce it, and we will never stop until clinical pharmacy takes the high road. At QMMC Pharmacy, we strive to ensure that all medicines are correct, appropriate, and served in a timely manner because we place patients at the heart of all we do. Thank you.